Welcome to the presentation on Good Clinical Practice, Part 4, Investigators' Responsibilities. The investigator should ensure the accuracy, completeness, legibility, timeliness of the data reported to the sponsor in the CRFs and in all required reports. Data reported on the CRF that are derived from source documents should be consistent with the source documents, or the discrepancies should be explained. The investigator or institution should maintain the trial documents as specified in essential documents for the conduct of a clinical trial and as required by the applicable regulatory requirements. The investigator or institution should take measures to prevent accidental or premature destruction of these documents. Essential documents should be retained until at least 2 years after the last approval of a marketing application in an ICH region, until there are no pending or contemplated marketing applications in an ICH region, or at least 2 years have elapsed since the formal discontinuation of clinical development of the investigational product. These documents should be retained for a longer period. However, if required by the applicable regulatory requirements or by an agreement with the sponsor, it is the responsibility of the sponsor to inform the investigator or institution as to when these documents no longer need to be retained. The financial aspects of the trial should be documented in an agreement between the sponsor and the investigator or institution. Upon request of the monitor, auditor, or IRB or IEC or regulatory authority, the investigator or institution should make available for direct access to all requested trial-related documents. Progress reports. The investigator should submit written summaries of the trial status to the IRB or IEC annually or more frequently if requested by the IRB or IEC. The investigator should promptly provide written reports to the sponsor, the IRB or IEC, and where applicable to the institution on any changes significantly affecting the conduct of the trial and or increasing the risk to subjects. Safety reporting. All serious adverse events (SAEs) should be reported immediately to the sponsor except for those SAEs that the protocol or other documents, example investigator's brochure, identifies as not needing immediate reporting. The immediate reports should be followed promptly by detailed written reports. The immediate and follow-up reports should identify subjects by unique code numbers assigned to the trial subjects, not by the subjects' names, not by personal identification numbers and or addresses. The investigator should also comply with the applicable regulatory requirements related to the reporting of unexpected serious adverse drug reactions to the regulatory authorities and the IRB or IEC. Adverse events and or laboratory abnormalities identified in the protocol as critical to safety evaluations should be reported to the sponsor according to the reporting requirements within the time periods specified by the sponsor in the protocol. For reported deaths, the investigator should supply the sponsor and the IRB or IEC with any additional requested information, example autopsy reports and terminal medical records. Premature termination or suspension of a trial. If the trial is prematurely terminated or suspended for any reason, the investigator or institution should promptly inform the trial subjects and should assure appropriate therapy and follow-up for the subjects, and where required by the applicable regulatory requirements should inform the regulatory authorities. If the investigator terminates or suspends a trial without prior agreement of the sponsor, the investigator should inform the institution where applicable. Also, the investigator or institution should promptly inform the sponsor and the IRB or IEC and should provide the sponsor and the IRB or IEC a detailed written explanation for the termination or suspension. If the sponsor terminates or suspends a trial, the investigator should promptly inform the institution where applicable. The investigator or institution should promptly inform the IRB or IEC and provide the IRB or IEC a detailed written explanation on the termination or suspension. If the IRB or IEC terminates or suspends its approval or favorable opinion of a trial, the investigator should inform the institution where applicable. The investigator or institution should promptly notify the sponsor and provide the sponsor with a detailed written explanation of the termination or suspension. Final reports by investigator. Upon completion of the trial, the investigator, where applicable, should inform the institution on completion of the trial. The investigator or institution should provide the IRB or IEC with a summary of the trial's outcome and the regulatory authorities with the report in ICH E3 format as per ICH E3 guidelines.